conversation. So if I could just take 1 minute to introduce myself, my name is Hemandez. I am a TV health reporter. I'm at KPRC, the NBC station in Houston. I focus only on health and healthcare issues here in Southeast Texas. I am today going to be serving as your moderator. So I have lots of questions planned for our amazing panelists, and I know that they've got some amazing responses ready for you guys. I am just overjoyed to see how many people have decided to join us. So again, thank you for taking time out of your morning, especially if you were out late trick-or-treating like I was. I know it's November 1st is always a tricky morning to get people to do things. So this just shows me that you guys are passionate about that topic, and as am I. So I'm very excited to see you today. I want you to know that this panel is being recorded, and it might be used for Molina Healthcare. It might be used on my broadcast as well. Not everybody's face is going to be on TV, but I might just use about 10 seconds of it on our 4 o'clock news. So this is being recorded. That being said, we have muted everyone, so you can just stay muted. You can just stay as you are. If you do have any questions, it was preferred that you just submit those questions in the chat area instead of people trying to talk over each other. Zoom kind of does this weird thing where if you try to talk over each other, like nobody can hear anybody. So it's best to submit those questions in the chat. We're going to have a limited time at the end to answer those questions, but we will definitely try to do our best to get to those questions. We'll have somebody lumping in any similar questions that come in and ask them as one. And that'll be at the very bottom of the hour that we have planned. So let's get right to it. I want to thank Edna Dudley for joining us this morning. Edna is our host today. Edna Dudley is the Associate Vice President of Healthcare Services for Molina Healthcare of Texas. And, Edna, I'm just going to turn it over to you now and let you tell us what we can expect today.
Thanks, Haley. Good morning, everyone, and welcome. And thank you for attending today's important discussion on schools as a hub for community to access quality healthcare. Again, my name is Edna Dudley, and I'm Associate Vice President of Case Management here at Molina Healthcare of Texas. And at Molina, it's our mission is to improve the health and lives of our members by delivering high quality healthcare. So this also includes our commitment to providing access to healthcare starting at a young age. There's been a lot of great work across the state over the past year, and the hope is that this panel lays out a little bit more about where we've been and, more importantly, where we're going, with a focus on how Texas school districts, community-based organizations, state government, and healthcare professionals can work together to ensure every student has the resources they need to grow up healthy. So I would like to introduce Victoria Ford, who is President and CEO at Texas Healthcare and Bioscience Institute. Thank you for joining us to offer opening remarks about your work in the state government and how schools can be used as a hub to increase access to essential high-quality healthcare, especially for our youngest Texans.
Thank you so much, Edna, and thank you to Molina and Haley for having me here today, and the Monument Group. And during the course of my career, which is about 30 years into it now, I've had a very unique opportunity to watch how school health services have changed. My background, I spent 15 years working in the Texas legislature as a legislative staffer. And then I spent another 12 years in the private sector working with healthcare partners and helping them address the legislative process. And then I went to work at the Texas Health and Human Services Commission, where I was a chief regulatory officer, but also worked with our other healthcare programs at the Texas Health and Human Services Commission. So I've had a pretty unique perspective on healthcare and how it has changed over the last 30 years. And today, schools play a key role in helping students in promoting health and promoting safety for students, but that really hasn't always been the case. So I want to put a little bit of this discussion into context today I remember when I was in school, which is how every single public policy discussion starts. I had one or two conversations with the school nurse, who generally called my mother to pick me up because I had a fever. I had one or two conversations with the counselor at our school talking about my class schedule, and maybe I had a half a semester course on healthcare and general health issues. That was about it. And once I got out of college and started working as a healthcare policy analyst for state representatives and a state senator and the governor's office, I really started watching how that phenomenon was changing in schools and changing in our communities. I remember one of the first programs I ever learned about was an asthma program at a school district in the San Antonio area. They had identified that children who have asthma had a high number of absentee days, and they developed a program within their school district to identify these kids and work with them and their parents to help keep that child in good health so that they could be in school more often, but stay healthy and have the ability to thrive. That was one of the first school health programs that I really learned about over the years, and they really keep on growing as we made our way through the 90s. It was not just asthma, but nutrition programs, diabetes programs. I worked for a state senator who passed some legislation that gave schools the tools to screen for acanthosis nigricans, which is a pre-diabetes screening process for children, generally at the high school age. And that helps them, helps the school identify these kids and then engage with them in nutrition education, as well as diabetes screening. Children no longer are encountering just infectious diseases or childhood diseases, but they are, in many cases, dealing with chronic and ongoing diseases and rare diseases. Another aspect of school health that has evolved in the last 30 years relates to children with who are differently abled. That's both physical disabilities as well as intellectual disabilities and learning disabilities, which can fall in either of those two areas. The laws over these years have started to require that these children have plans of care put in place, and that they have folks to help them navigate through the school system in a way that promotes their abilities and helps them grow and thrive, but also helps manage any chronic conditions that they may have that are challenging and difficult to deal with throughout the school day. And again, this comes back to two fundamental principles. A child who is at school is a child who counts as attendance, but it's also a child who has the ability to learn and continue to thrive. And this is not just happening in low-income schools. I actually Googled this morning the wealthiest school district in the state and learned about their school health clinics that they have throughout that district. So it's really becoming an endemic service across almost every single school district. Finally, I want to touch a little bit on mental health. Since 2001, since 9/11 really, and many of the school-based tragedies that have occurred since then, the expectation of families and communities that schools become a care almost a provider for the mental health care of their children, but also a caretaker of the children while they're at the school, trying to keep them, help them through the grieving process, help them through a traumatic process. That has really dramatically changed the nature of how school services, health services are provided in schools as well. So for those of you on the front lines, I know many of you on this call today are on the front lines doing all of these things that I've just talked about. I just wanted to kind of set up the context for the discussion, incredibly informative discussion that you're about to have. I think all of you also know that these changes haven't come without challenges, political challenges and other challenges with folks who have different opinions about how these services should be, how and whether these services should be provided in schools. So we hope that that we can identify some of those places where schools might need some support in the future to continue to maintain these services. So that was the background and context I wanted to lay out to set up this incredibly important conversation. Haley and Edna, again, thank you and the Monument Group for the opportunity to be here today. And I really look forward to hearing the rest of the discussion and everything that we have to talk about.
Thank you, Victoria. Yeah, I know everybody's going to enjoy this. And just to add to what you were saying, I also sit on the board for Mental Health America. And yes, students right now, unlike when we were young, are seeing their school nurses and their school counselors for way more than a spiked fever and a class agenda. You know, all of their physical and mental health have merged together during the pandemic. And so I appreciate all of you expert minds coming together today, because we just need to have this conversation over and over again to find solutions. So with that being said, again, thank you, Edna and Victoria and Molina Healthcare of Texas, along with Molina Cares Accord, for bringing together this today's expert panelists. I am going to introduce you to them one by one now, and if they could just turn on their cameras so that we all know who we're talking to. Mayela Castanon, CEO of Community Health Development in Uvalde, Texas. Good morning. Becca Harkleroad, District Lead Nurse at Lake Travis ISD and Advocacy Chair for Texas School Nurses Organization. Gwen Johnnson, the former Director of Health and Medical Services for Houston ISD and a nationally certified registered school nurse. Hannah Sukany, Director of Network Development for Communities and Schools of Texas, and Brian White, CEO of Good Side Health. Thank you guys so much for joining us. Thank you for turning on your cameras and letting us see your smiling faces. I will begin today by talking about just everything that Edna and Victoria have already hit on, that schools they're just a vital resource for our kids, for the parents. They provide not only education, but we rely on schools for education. Some families rely on schools to feed our children, and just a whole lot of their needs, their supportive needs. I know that teachers often support the parents just as much as they do the students. So they are a wonderful community resource, but it's just inevitable that healthcare is going to have to bleed into that. It seems like the natural next step. So Becca Harkleroad, I'm going to start off with you. As you care for students as a school nurse and you're in the schools every day, just share with us what your nursing team is seeing, what you're hearing from students as it relates to the kind of care that they're going to need inside of school. And as I brought up the pandemic a little bit ago, you know, how has the pandemic really changed that? What are you seeing more needs now because of the pandemic? Oh, you're muted.
Sorry, I think that's a really good question. So it's interesting because the pandemic pushed school nurses to the forefront of people's minds. But school nurses have been doing what they do for 120 years, rooted in public health, the disease surveillance, and the assistance with educating families. So right now, what our nurses are seeing is all of their usual routine duties, right? Medication administration, just like when Victoria was talking, I just was thinking, check, every single thing she was talking about. Our kids with special medical needs who come to school, right? They have a whole team of specialists. They see an ologist for every organ system, a cardiologist, a neurologist, an endocrinologist. And then those kids come to our schools. And so our school nurses need to be at least somewhat educated and familiar with all of those things so that they can train the staff on their campus. I think the pandemic for those families was very hard and it was very scary because there are so many things that we just don't know because we're at this part of knowing about COVID and there's so much more. So I think that has been a big deal for a lot of our nurses, is just providing reassurance to those families and doing their best to educate other people and create a safe place, working on infection control, talking to the little kids a lot about, you know, disease prevention. And when Victoria was talking about asthma and asthma care, we can talk about that a little more in just a minute. But I think one of the biggest things for our nurses, you know, when we came back in the fall of 2020, our goal was to keep healthy kids in class out of our nurse's office, right? The school nurse's office is kind of ground zero for germs and bugs and things that'll spread in the school. And so to try to keep our healthy kids in the classroom where, hey, they maybe can manage their own, you know, clean the cut and put a Band-Aid on it, or get a wet paper towel, you know, and just understand, really it was good for those kids because it gave them an understanding of how to care for themselves, right? That's a big thing. That's a life lesson that we all need to know, how to care for yourself. But now what we're seeing as we've been back and, you know, I think we talk a lot about the fatigue that comes from the pandemic, and it is across the board, right? From the highest of high superintendent or CEO of a company all the way down to our little kinder and first graders. And I think what our nurses are seeing a lot of right now in that regard is kids who may not necessarily really need to be seen by the nurse. They really need to be seen by an adult who's going to love on them and recognize that maybe they're not having the best day right now, but that it's going to be okay. And I say that going into discussion about mental health. You know, the school nurse's office has been identified by a whole lot of students as a safe place where they can go, right? A kid may not feel comfortable raising their hand and saying, hey, I'm having some pretty dark and twisty thoughts. I think I need to go see the counselor, but they sure feel comfortable raising their hand and saying, can I go see the school nurse? So the school nurse's office is where kids land when they need to talk about their stressors or their triggers or their anxiety. And so we partner really closely with our school counselors and our other school-based mental health providers. But there was a high school, actually a study pre-pandemic said that, especially in the secondary levels, school nurses reported spending at least a third of their school day handling and triaging and working with mental health cases. And I would say post-pandemic, that will have gone up to at least 50%. And not just in our high schools, our littles, our elementary kids, right? That tummy ache that just shows up out of the blue every week before the spelling test, or on mornings that they stayed the night at their other parents' house. You know, a lot of physical manifestations of anxiety appear in kids, and helping those kids understand their bodies and learning to listen to their bodies is a big deal. And the earlier we can start that, the more helpful it is. But I would say definitely post-pandemic, what we're seeing is kids just needing a little more reassurance. And then our kids definitely with true mental health crisis, they land in the nurse's office more often than a lot of people would probably think.
I hear that, and I'm so proud of you for recognizing that, and recognizing that, you know, school nurses need to have the resources to care for all of these kids. And everything you're saying, I'm like, yes, I want you to be my nurse. That sounds wonderful. But again, we know that school nurses have been burdened during COVID, during the pandemic, with just more kids than they can probably handle. So I'm going to take the conversation into the direction of Brian White. Brian, nurses, as I mentioned, have had a lot on their plate during COVID, and certainly even more now that we're seeing, you know, all those ripple effects of what the pandemic did to our children. So how can we add the resources and empower our school nurses so that they can give services on to our children without just adding more work to them, to their plate?
Sure. Haley, that's a great question. I mean, we all know the heroic efforts of these school nurses, especially now, and how vitally important they are to the health and well-being of the students which they serve and care for. And Becca did a fantastic job of outlining the daily task of a school nurse. A lot of it, you know, to those of us that aren't nurses, it seems like that's beyond the scope of what we imagine a school nurse does, but they do so many great things for these kids, especially after the pandemic. So we got to start to think about, hey, how can we empower them with other tools to make sure that they can handle all these new tasks, and how can they provide healthcare to these kids? So, Becca talked about keeping healthy kids in the classroom. And what we also need to do is talk about kids that aren't healthy, that are sick, and the ability to keep them out of the class from spreading disease to other kids. So in Texas, school nurses can't assess, diagnose, or treat students in their office by statute, yet that doesn't stop the flow of sick kids from coming in, many of which have strep, flu, COVID, et cetera. So we really need to empower these nurses to be able to diagnose and treat these students and reduce the burden that we've placed on them by eliminating these repeat visits for the same issues, some kids that are sick that camp out in the room all day, and then also quickly identifying these communicable illnesses and preventing those from being spread to other students and compounding the problem. So this can be, and is actually currently being addressed by leveraging technology to enable school-based healthcare. And so really by giving the school nurse access to a physician or other healthcare provider via two-way video communication, the nurse is now able to work with a live provider on an iPad who can now diagnose, treat, who can test for rapid strep, flu, COVID right there in the nurse's office, and can prescribe medication to get this child well, the ones that truly are sick, get them well and back in class sooner, and prevent them from spreading illness to others. And our company, Good Side Health, we've run this program in over 600 schools so far in Texas, and we see it every single day. More and more nurses who are excited about the ability to utilize this telemedicine technology and to offload the burden of all these students that are crowding up the nurse's office. And they feel like telemedicine is an empowering tool to help them do this.
Okay. Hannah, I'm going to bring you into the conversation as well. You're with Communities in Schools, and we know that you served underserved students across the state, more than 100,000 students to be exact, across 175 school districts. I myself have done reports with grief counselors with Communities in Schools, so I understand many of them went and talked to children who lost parents and grandparents due to COVID. That's just one example that I can think of. But how has providing healthcare to students in these underserved areas helped those students perform academically, whether it's their graduation rates or just breaking the cycle of poverty? What can you tell us about what Communities in Schools is doing?
Yeah, thank you for that. As mentioned before, it's impossible to have this healthcare conversation about our students without addressing mental health at this point. And Communities in Schools is the largest campus-based provider of mental health and behavioral health supports for students in the state. And so how we have seen and how we've really been able to impact students' lives is first and foremost through parental consent, very important and always the first step. But we are able to, our site-based specialists deliver CIS's effective model of integrated student supports, ensuring that the whole child, the whole school, and the whole community have access to the supportive services necessary to impact the success of the student. So this integration of mental health and comprehensive services onto the school campus is a critical path forward in promoting the students' whole well-being. As Becca mentioned, schools are most likely the first place where mental or behavioral health concerns are brought up with the student outside of the home. So being able to address the student, the family, the community needs on this holistic level really allows the student to get the services that they need, the support that they need, the referrals out, while also serving the student in the school so that they can gain the focus that they need back on their education, and make those gains in education so that they have hope for a brighter future. That's all communities and schools is about, right? So we want to make sure that the students have the support that they need to be successful in school and also in life.
Which is obviously a very admirable mission for your organization. Is there an easy way that people on here who might need your services can contact communities and schools to get that support in their school?
Yes, so we work on district level. So if you do not have communities and schools in your area at your district, you can contact your district officials. You can also just contact me. I don't know if you're giving out contact information after this, but I can put you in contact with the affiliate. There's 27 affiliates across the state that saturate most of, if not all of our areas. And so I can get you in contact with the closest affiliate to your district.
Thanks, Hannah. Yeah, I'm sure somebody can help pass along your information. I've already posted your cell phone number and social security number in the chat. So
Perfect. Thank you. That's
totally
another way to get a hold
kidding.
of me. Yes. I love it.
Totally kidding. Mayela Castanon, I'm going to ask you a tough question right now. I know that you are currently in the process of expanding healthcare in the Uvalde district. That is, as I mentioned at the top of this conversation, that's wonderful for parents who don't need to take off of work to take their child in to see an appointment. But unfortunately, I can't ask you this question without mentioning the tragedy that we all know happened in Uvalde in May. So in your efforts to expand healthcare into school, how is that tragedy changed what you're hoping to achieve?
Well, thank you for allowing me to be part of this panel. I'm honored to be amongst so many very experienced panelists. And Hannah, I've taken your social security and phone number because I will be reaching out to all of you. But Haley, it's been difficult. The tragedy has prompted us to initiate the school-based clinic in Uvalde. We have several goals. One is the immediate goal to provide a peace of mind to the parents. As you know, in Uvalde, parents are navigating a new world full of pain, frustration, disappointment. And the parents they fear for the safety of their children in schools. So while we cannot take away some of those fears, I think we can do what we do best, provide quality care to their children while they're in school. So for us, it is important for the parents to feel, to have a confident and peace of mind that their children's physical and mental well-being is going to be taken care of, and that is going to be a top priority for us. So doing that, initiating a school-based clinic, I feel that that's a way for us to be able to give that priority. And then when the need arises for the children's healthcare to be taken care of, that we're going to be there, and we're going to be there promptly. So that's one of our immediate goals, to provide that sense of security, of peace of mind, so the parents can feel confident their children are going to be taken care of. The long-term need for us, or goal, it is to bring awareness to the students' overall healthcare needs. Maybe by providing, identifying red flags, screening children for behavioral and mental health issues, and not only identifying those issues at an early age, but most important, closing the loop, making sure that the child that has been identified with mental, behavioral health or physical issues, they get the attention that they need. Maybe next time we dropped the ball this time. So we're hoping that by us being there and close to them, identifying those issues, that we can go ahead and make sure that the child gets the help that they need. Our youth are our future. And as adults, we have the responsibility to do something for them. So I believe, based on all the comments from the rest of the panelists, that the school-based clinic is already a proven way to take care of that. And we would like to be part of that.
Well, please keep doing what you're doing. I think a lot of us in this chat would agree that we've all been praying for Uvalde, and especially the parents there. So thank you for being an earthbound angel to help them through this process, and just keep doing what you're doing.
Thank you.
Becca, no, I'm sorry. I'm gonna ask Gwen Johnnson a question now. Gwen, with HISD, being the largest school district in the state and being incredibly diverse, I know diversity brings its own challenges. The students are literally coming from different locations, different cultures. So I want you now to talk about some of the challenges when trying to meet their unique needs, and what are some of the successes that you've found during your time as the health director for Houston ISD?
Thanks, Amy. And like so many others, I'm honored to be among such a group of caring individuals. And Mayela, we do send our hearts and prayers out to your community. So data is as a foundation, it only serves as a foundation for meeting healthcare needs. It's really the people, and you've heard already from so many people here who are willing and ready and able and skilled at providing and meeting healthcare needs. So my approach when I was on in the district was to really look at the data, of course, and review the data for those things that would stand out, but also reach out to site-based partners who was on the campus, who could provide me with the groundwork, with the information I'd need if an opportunity arose that I saw might be suitable for a campus or a community. You know, reaching out to that campus directly was always my very next step after looking at the data. And from my vantage point, of course, at the time was to reach out to the school nurse. The school nurse is very skilled, along with the other partners, and has worked with other partners on that campus, including CIS and mental health, and to really have a bird's eye view of what are the needs on that campus. So I would always be willing to sit down, not only with the school nurse, but of course with the school leader, and to be able to express and understand the needs and express them back to that community or to that school leader in terms of academic success. Where were we going? What benefit could this opportunity provide to the campus, and not only in meeting their healthcare needs, which we know and has been proven to improve attendance, but how can it improve also their academic success? So reaching out to the school nurse was always a key starting point. And yet it was always baffling. I'd use data, of course, to look at, and we still are struggling with meeting simple needs for children, such as having eye care. And so taking that as an example, if children comparing two campuses in close proximity where the students had unmet vision healthcare needs after the screening had been conducted by the school nurse, what were the differences? What were opportunities there that a community partner, our public health department, what opportunities were presented in that situation in either one that could propose a solution, and how could our partners work with this on that? We worked closely with our health department and with other community providers, and using vision as an example, having partners who would actually, there was a program in which children would be identified as having not yet received vision care. And we work closely with the health department to provide bus transportation to a single site with parent permission, of course, where those children received a professional eye exam and glasses at no cost to the parent. And then those glasses were delivered to the campus and fitted for the child. So therefore reducing the need. So the barrier in those communities could be not having an appropriate or a healthcare provider, an eye care provider in the proximity, or simply access to that provider. Also working with our Eye Care for Kids Foundation with students who did not have health insurance, because not having health insurance is definitely a barrier to healthcare access. And our school-based clinic partners, when I was in the district, that was certainly a prime way to provide access for these children to care. So really vetting our partners thoroughly, and that is a change over time. You know, there was a time when it was much easier to bring partners on campus, but now with all of our concerns about child safety and being protective of our children, our partners are vetted much more heavily than they used to be, and appropriately so. So these challenges, there's plenty to say grace over, as they say. And so working with our community partners, not only starting with the data, but also involving the people, involving committees and groups of people on the campus who can provide feedback and show us and guide where the gaps are. Thank you, Haley.
Thank you, Gwen. And Becca, you know, she mentioned school nurses. It sounds like HISD has come up with several innovative ways to provide resources to students. Has Lake Travis ISD also found similar innovations? I saw you nodding your head a lot just now.
I know, I was definitely nodding my head through everything Gwen said. I have so much respect and admiration for Houston ISD being so large and being so diverse, you know, from every aspect of what could be different and could be the same for your kids, right? And being able to meet the needs of people at the campus, like what you were saying. It's not one size fits all for Houston ISD. You can't say we're doing this for all of our schools because your schools are all different. Lake Travis ISD is a much smaller school district, right? We have 11 campuses, and we face some of the same challenges because in our area, the families, the households in our area typically are well resourced, and so being able to provide resources for families who lack those, just like what you were talking about, transportation is often a barrier, or a parent being able to, you know, if they're not at work clocked in, they're not getting paid. And so that's really hard. And just like what y'all were talking about with the asthma care, right? That's something that we're looking at now, actually at the state level. Texas School Nurses Organization is advocating for campuses to be able to implement stock albuterol, unassigned albuterol. So any kid who's on campus who's experiencing respiratory distress can get the life-saving medication they need right then in the moment. And then if we have kids, because not everybody who's having respiratory distress has an asthma diagnosis, but if we have kids who come into us and we do treat them in that way, and they don't have a physician, then it's incumbent upon the school nurses to be able to provide resources to get that person to the care they need, because asthma is chronic and lifelong, but it's also a treatable condition that if it's well managed, you can avoid being in a bind. I love that Gwen was talking about screenings, and Victoria earlier was talking about screenings. We happen to live in one of the Education Service Center regions that does perform the acanthosis nigricans screening on our students. That's the one she was talking about that can be really a precursor for type 2 diabetes, high cholesterol, hypertension, issues that could come along later in life unless there's early intervention. And just like what Gwen was talking about with she was talking about it from a vision standpoint, you know, we do our state level vision and hearing screenings every year. And last year we had, I think one is enough. I think one is a great breakthrough, but last year we had 2 different kids that we referred because they weren't hearing, and they both had surgery over the summer to fix a problem. And I think that's I think that's really remarkable for school nurses to be able to catch stuff like that and intervene and be able to raise the flag and say, hey, we need to get this taken care of. But also, one of the things that's great with our partnership with the National Association of School Nurses is that they are able to provide vouchers for our students. If they don't pass their vision screening, we can provide to them a free eye exam and a free pair of glasses. We just with a certificate, similar to what Gwen was talking about. We don't have the population, and we don't have the resources out here for the transportation like what you're talking about, but being able to find affordable options for those families has been really helpful and very much appreciated, and we can tell that. Another thing that we did this year, so in years past, we've always held a flu shot clinic, a voluntary flu shot clinic during the school day. And we've used the same company. It was a national company. They came in, they did great work. Well, somewhere between the pandemic and this year, their company went out of business. And our community really likes the convenience of having that flu shot clinic at their campus. So I reached out to a local pharmacy and just partnered with a local pharmacy and said, hey, can we do this? And they came in and they made it happen, and it went really well. And it was great. We had a lot of kids who are now vaccinated against the flu that might not otherwise have done that, right? Their parents might not have been able to or taken the time to go do that. I was talking about albuterol, and I think I would be remiss in this day and age to not talk about what's going on for our schools with fentanyl, the opioid crisis and fentanyl. And so we were or are actually able to provide Narcan on all of our campuses. We have it in stock for all of our nurses and administrators and campus police force. But it's not enough to just have Narcan, right? Like that's great for after something happens. Prevention education is such a big deal. And our district has really helped get the word out. Our school nurses are really working to make sure that our kids are safe in school in that regard.
Everything you're saying is just, phenomenal. I'm glad that you guys have figured out how to do this. And I'm sure everybody in the chat is like, I wish my school did that. That's awesome. I wish we did more of that. But where it goes down to funding, right? I mean, where are we going to get the money to do this? Hannah, can you talk about what is Community and Schools suggesting? Who do we need to advocate for us to make sure that more schools have resources like this?
Yeah, so we've definitely seen Communities and Schools. Our schools have seen an increase in funding from the legislature since the beginning of COVID, and really providing that support that we've needed. Communities and Schools has seen an increase in funding from our legislator, where we've been able to turn around and serve 500 plus more schools since 2019. And that equates to tens of thousands of students, of families being served. And a lot of those have been in our rural areas and our underserved areas. We go through a process of identifying the schools that are have the least resources, right? So that we can make sure that those dollars are going the furthest. And so not only do we need to continue to advocate for that funding to be continued for entities like Communities and Schools, but also for our nurses, also for I love the idea of a care clinic, and understanding that all of these separate entities need to be funded and continued to be funded, because as we've mentioned before, we are in a what is being called a youth mental health crisis right now, and it's not slowing down. So understanding and recognizing, advocating for our legislators to fund and properly fund our programs, but also educating our school districts. They're busy running their school districts right now. So how do we help them understand what areas they can use to fund these programs, to keep these programs funded past the next legislative session?
Mayela, now that Uvalde is getting so much attention from lawmakers, have you found that there's additional funding coming your way? Has all the attention from the Uvalde tragedy, has it in some way benefited your organization's mission to provide this healthcare to children?
Not from the federal state, not at this time, but we have been fortunate to have great partners that came to our aid almost immediately, Molina being one of them. And thanks to their donations and continued support, we were able to provide services to our patients and the whole Uvalde community immediately. We were able to increase our behavioral health department from 1 psychiatrist and 2 LCSWs. We were able to add 8 more, including child psychiatrists. So all thanks to the donations and all the pouring of support from many partners. Not only have we used the donations to hire and partner with other and contract behavioral health providers, but also to provide the services to the patients at no cost. And we will continue to support that while we have the financial means. So one of the things that we do ask from our partners, our donors, is to continue providing some assistance to us in the future for years to come, because this tragedy, unfortunately, has long-term consequences. This is going to be decades, and eventually we haven't had the time yet. We're still dealing through all this challenges this past 5 months. And we have not looked for any federal or state funding, but I'm pretty sure that they will listen to our pleas and come to our aid.
Yeah, I hope that you're exactly right. This is going to happen for years to come. So I hope that continues to come your way. As we're talking about getting healthcare to all students across Texas, Brian, I'm going to ask you, because we talk a lot about major metro areas, which we have quite a few of in Texas. Those kids have sometimes difficulty accessing healthcare, but it's an even more obvious problem in rural areas. So what would you suggest we do to get quality healthcare out to the rural areas that have a definite challenge with accessing healthcare?
Yeah, that's right, Haley. I mean, healthcare deserts and lack of
Yep.
health equity are a real problem in the country and also in Texas, where we have no shortage of large rural healthcare or large rural areas. So, we love school-based health centers. We think bringing care on campus is fantastic, but that's just not always possible in a lot of corners of this state. And so, we need to think about, hey, how can we deliver care to all portions of the state with the same consistency and quality that they get in Dallas, Fort Worth, and Austin, San Antonio, and Houston. And so, when we think about how to address this health equity issue, I keep coming back to, telemedicine, telehealth is really the great equalizer here. A telemedicine visit, if you think about it, that's conducted at school, whether it's in a nurse's office or elsewhere, it's really available to any campus in Texas, no matter where they are. It's accessible to any student who wants it, as long as they have consented to receive care. And that same quality healthcare that students in large urban areas are receiving, that same healthcare can now be delivered to any student in the state through an iPad. I know within our company at Goodside Health, our same physicians that see patients in one of our urgent cares in Dallas, 5 minutes later can flip over, and now they can see patients in the Rio Grande Valley through telemedicine. It's a fantastic way to leverage technology to bring healthcare anywhere we want. And Becca was mentioning screenings earlier, and Uvalde is a great example too of hey, how can we screen kids not just for physical health needs but also mental health needs anywhere in the state. And we've done thousands of these mental health screenings, the PHQ-2s and 9s, sometimes utilizing in person, but a lot of times utilizing technology. And so imagine a state where now any kid in the state can be screened for mental health issues via telemedicine without having to go through the cost and expense of putting providers and personnel to every county in this state. So we feel like the ability to provide portable, compact, consistent school-based healthcare, whether it's physical or mental, whether it's treating acute issues or screenings, is the key to ensuring that all students in the state have equitable access to care.
Brian, I'll just follow up really quick with that. Do you have any concerns about not being able to access providers as regularly as you were able to during the pandemic?
You know, we've seen a large increase in the demand for providers to want to provide services via telemedicine. So I think what I'm describing is a shift towards more providers wanting to deliver services, not just in person via telemedicine. So it's kind of been a little bit of the opposite for us, where before offering a telemedicine position might have seemed a little odd. Post COVID and now at the other end of this pandemic, it's very much a desirable way to deliver healthcare, and we're seeing more and more providers want to sign up for that.
Good to know. Thank you so much for answering that. Gwen, I wanted to let everybody know that we are answering a lot of the questions that are popping up in the chat. So I'm going to ask a few more questions before we finish up today's conversation. Gwen, I want to talk about how you found success in talking to parents about sensitive issues. We've already heard, Becca mentioned fentanyl earlier today. We know drugs and addiction starts at a young age, but we also have had, asking people to get the COVID shot was a sensitive issue. The HPV vaccine series can sometimes strike a nerve with parents. So what has been your experience with working with parents so that they understand the long-term health benefits to their children?
What's key in working with parents is really that they're working with a trusted source, that they're receiving accurate information from someone they trust, and often from a recognized community organization or a campus-based staff member. The school nurse is among those individuals who's trusted. So providing education that is honest, accurate, and providing that information clearly, and giving parents an opportunity to ask questions, even in an open forum as well as in a one-to-one where they can really discuss their concerns about an issue, is really very important. The HPV vaccine, and Becca's hit on providing school level vaccines such as flu, and the HPV vaccine is another vaccine initiative that can bring a lot of success, but it also requires a lot of education with parents to understand the value of a vaccine that is not required, but however is so invaluable in preventing cancer. So how that information is presented to a parent, in what format, what channels, how do they receive information about the vaccine, and then following that with a clinic that provides that vaccine along with other adolescent vaccines is really, really important. So really giving parents a forum for their questions and concerns, but also giving and providing immediate support for whatever their concern is, or addressing the issue. Even on fentanyl, those issues are being presented in a forum where parents are able to address concerns about mental health and drug use in a manner that provides them some confidentiality as well as an open forum.
Becca, can you share what's at the top of your list of needs to ensure that schools do have the ability to be a hub for community health?
Well, I might be a little bit biased, but the top of my list always and forevermore until it happens is going to be for Texas to have a full-time registered nurse every campus every day. School nursing is actually, when you look at it and where we have school nurses and where we don't, school nursing can be addressed as a health equity issue. Just like what Brian was saying about being able to get telehealth and telemedicine into those rural areas, people who come from places where there is a school nurse just assume that everybody has a nurse, but there are more than 10% of the counties in Texas don't have a school nurse employed anywhere within the county. And that was most severe in our rural areas and some of our Rio Grande Valley areas that are traditionally underserved. up until just a few years ago, well, actually, I want to go back to what Hannah was saying about that the funding that came from the pandemic and how great that was. And then I think Mayela also talked about, the funding that has been injected into their program in the wake of all this other stuff. So that came from the American Rescue Plan Act and the ESSER grant that we used and dispersed. And those funds were great and they were so helpful and they brought so many resources to our schools that we desperately need. But those funds are finite and they end at the end of this school year. So I'm going to ask for a school nurse in every school. How are people going to pay for it, right? That just sounds like a great idea, but who's going to pay for it? So I think we do have a solution, or at least a partial solution, to so many of the funding things that have been talked about. Before 2014, the Centers for Medicaid and Medicare Services said that schools could only bill for services they provide to students who are in special education and have it listed in their individualized education plan for them to receive these services. In 2014, CMS changed that rule and said, hey, if you have a kid in your school that is Medicaid enrolled and you provide services that would be billable by Medicaid, you can bill Medicaid for those services. That includes student health services, that includes screening services, that includes mental and behavioral health services. And it doesn't cost Texas a dime because it's federal matching dollars. Our schools are already state funded. The federal matching dollars are there and sitting there. We just need to update our state's Medicaid plan to be able to take advantage of those funds. So that's something that we're really going to be asking legislators to help with and to support in the upcoming session, that we can take advantage of these funds. And it's not really going to require any new department, right? Because we already have our student health services and we already bill Medicaid through school health and related services. So basically free money that we could take and utilize to pay for a lot of the stuff that we're talking about today that's on a finite budget. Does that make sense?
Sorry, yes, I was muted. Yes, that makes perfect sense. I saw a lot of head nods. I think a lot of people are in agreement with you. Unfortunately, because of timing, we are going to have to skip the Q&A. I believe that most of our panelists answered a lot of those questions as we were moving along here. But if you still have questions, then the person who is receiving your questions in the chat right now will do their best to funnel the questions directly to the person who's best suited to answer them. With that being said, I'm going to bring Edna back into our conversation. Edna, just to close us out here, can you please talk about Molina Healthcare of Texas's view on the importance of ensuring that students have access to the resources that they need to be healthy, to be successful, to just go to school and learn like they're supposed to be, the kids that they're supposed to be?
Yeah, absolutely. So as previously stated, Molina's mission is to improve the health and lives of our members. So it's our collective responsibility to instill healthy habits in our next generation, which we've all been discussing, and great discussion, and just to ensure that our children grow up in a world that prioritizes both physical and mental health. So Molina continues to expand and implement initiatives that collaborate with communities, school districts to take more of a proactive approach and helping close this gap in care with healthcare needs. So healthcare access in schools is a crucial piece of the puzzle, and expanding services that otherwise might be too hard or daunting for students and parents to access. And building a foundation that prioritizes health and wellness throughout their lives.
Very good. Thank you so much. I will thank everybody for joining us today. This has been a really informative and passionate subject. If anybody has one last thing to say, I will let you, but it is noon now and we promise to let you go at noon. So thank you everyone who joined and made this call such a success this morning. I really appreciate it.